Fresh Economic Thinking podcast, new ideas and analysis with Dr. Cameron Murray and Jonathan Gadir. Hi Cameron, how are you doing?
Good, thanks Jonathan. Nice to be back with you.
Bit early in the morning, but let's see if we can wake ourselves up with some stimulating discussion. So I saw this headline: the grandchildren of Omicron have landed in Australia. What does it mean for Christmas? A variant soup of COVID strains has arrived. I wanted to raise this with you because, well, I guess, to be honest, it is one of the issues that obsesses me because of the trauma of the last 2 years and of, made me do things like join the New South Wales Council for Civil Liberties, where I'm now on the executive committee. So, it's sort of an important thing for me. But I know that you actually have taken an interest in certain aspects of this from a sort of a data perspective. And you did some freedom of information requests. Can you fill us in on that?
For those who followed me for a while, you know that I've been very outspoken about the COVID panic and policy response since we started, because the basic health economics and the pandemic plans we had said, don't panic, keep the economy and society functioning as best you can, because that's what allows us to treat people well, to provide high levels of care, to reduce stress and anxiety, and to make sure we don't inadvertently introduce other health costs in our response by focusing on this one. So I've been very outspoken. I was on Q&A last year explaining all this. I've been published in the press. So I've taken a strong interest. And one of the things I've taken an interest in is that Australia had introduced a compensation scheme for injuries for the COVID vaccine in December 2021. They did this not because it's rare, and it's because it exists, it's real, and people were genuinely injured. And what I found puzzling is how few people know about this and how little interest there is in looking at the data. So I put a freedom of information request into the health department and said, how many people are there? How many applied for this scheme? If it's very low, I would like to know. Like, surely if we think the vaccines are all that they were promised, then this should be a wasted system, right? There should be no one there. And what I found when they responded was that in the first 8 months, so December to July inclusive, that's up to July 2022, there were 2,622 claims, only 29 approved, 139 denied. And to get a claim, you must have received the COVID vaccine, been admitted to hospital as an inpatient because of the harm you suffered, and have losses or expenses of $1,000 or more, excluding pain and suffering. So it's quite a high bar. You had to be admitted to hospital and spend $1,000 of expenses. It's not just like, if you go to the emergency department at a public hospital, you might not get admitted and you might not spend anything.
Well, can you be admitted to a hospital, but it doesn't cost you $1,000, so you're not counted?
Well, we'll see. Like these are the things we don't know. I suspect it's an or condition, right?
Okay, right.
Although the way it's worded doesn't seem like an or condition. So we will see. We will see.
Yeah.
But this is quite substantial, right? So we had the Pink Bats home insulation scheme a while back. Remember the stimulus after the financial crisis? I think it was the Labor Party subsidized people to insulate their ceiling. And we had, I think, 5 deaths by electrocution of people installing Pink Bats. And we had a royal commission. We had a royal commission into that because of the policy. Here we've got nearly 3,000 people claiming injury. Of course, and if there are any deaths, they're not included, and yet the media doesn't want to know about it. I've seen one article since December 2020. Someone put an FOI in a few months after that. There was one article on news.com and it was ignored by everyone else. And so it's taken me, this quirky economist writer who has an interest in health policy, to go and do this and report it. And yet, if these were 2,600 hospitalizations for COVID instead of the COVID vaccine, wouldn't this be the biggest news story going? So I find it completely bizarre, the attention, the disproportionate attention we have to genuine harms when they're not called COVID. It puzzles me.
And devil's advocate here, is there a justification theoretically because, like long COVID affects so many more people, like there's lots of articles on things like that, long COVID type stuff. And, this is like a really small number of people in comparison. Is that a justification that would be like a plausible?
That's a story. That's certainly a story. The long COVID evidence is pretty thin compared to the media reporting of that also. So recent studies have come out from Israel looking at patients admitted after having COVID and for any reason and not having COVID, and looking at the evidence of sort of myocarditis and pericarditis, the inflammation of the heart. And they found no difference between the hundreds of thousands of patients that they tested who had COVID and the hundreds of thousands they tested that didn't have COVID in the previous months being admitted to hospital. So the suggestion there is that, COVID is not, probably, if you read the media, your understanding of the long-term risks is not in proportion to if you read the academic medical articles on it. So that's one story, but I haven't seen or read evidence, and I'm certainly interested in it. I don't read the news for evidence. I read the academic papers that come out. So look, it just seems out of proportion to me.
And like Norman Swan, the ABC's health reporter, had his graveyard voice on this morning, talking about how we all should start being worried again, because it's very important that I be worried. That's going to make all the difference. And because there's, this COVID wave coming, and that all these people that, should have had 4th and 5th doses of the vaccine haven't had it. And this is worrying, and that people are not doing mask wearing, which is also worrying, apparently. And, we should all be trying to avoid getting it, which is strange to me because I have no understanding of what we're supposed to do to avoid getting it. It doesn't seem to be a real world statement.
Yeah.
But I'd like to point out that you're talking about a silence here on this particular type of harm that you are interested in. So it's interesting that there's a pattern where outlets like the ABC and the quality media have kind of picked a side, and that side is like the side of, let's say, institutions, and that's sort of where their audience is. It's like people who are in academia, professions, public service, NGOs, human and social science professions, and all people that aspire to be or identify with this group of people. And very quickly, there's been a sort of the COVID pandemic has been an opportunity to quickly sort of have this solidarity with other experts, whether that's subconscious or not. And I guess the catch is that the experts quite often have their own biases and their own extremely obvious vested interests, professional, personal, and other vested interests for advancing, arguments in one way or another. But we talk about things as though everyone else has bias, but the expert class doesn't.
Look, I've noticed that too, Jonathan. Look, if you try and talk about this, you'll get shut down on social media. I put up a link to one of those vaccine injury stories from a young Australian. And people just said, you're going, this is all bullshit. You're going up. Don't go down this road, Cameron. What are you thinking? I'm like, this guy is paralyzed because of the vaccine. If this was, a Liberal Party policy to do something and someone got paralyzed from it, you would all be saying how nasty and evil it was, it was ScoMo or Tony Abbott was, right? If one guy got paralyzed. And here we are, just because the tribes are different, your tribe you're being loyal to, you just can't accept one fact. Like, it's totally been true. And there's been very little, I find the journalists very poor here because all those experts have been wrong. I got shut down on national TV for saying, the vaccines aren't as great as we think, and we shouldn't rush to vaccinate children. The evidence doesn't seem to be there. I got told, you're not an economist, you're an idiot, this and this. Why are you going against the experts? And now, of course, the CEO of Pfizer had 4 vaccines and then got COVID. And most countries now aren't recommending COVID vaccines for children because of the risk. The risk is disproportionate. So I had it right. I was the idiot. And the journalists are still asking all those wrong people who aren't trained to let go of their sort of groupishness and their social attachments to saying the right thing and looking good in the eyes of other experts. So they just keep going back to those groups rather than this huge group of independent people out there who have been able to just look at the facts, including, of course, the top-sided living human scientist and epidemiologist John Ioannidis, right? The expert of all the experts was shut down because he didn't go with the crowd. He said, you know what, the infection fatality rate's lower than you think. We should keep the economy open. The masks aren't very useful. We should just follow the plans we had. And he had hit pieces written about him. So it's definitely true that that's the case. Can I just quote some of the data that came out from the ABS recently?
Oh, this excess testing, so intriguing. Yeah, go on. Yep.
And let me quote you from the Australian Bureau of Statistics. And I quote, in 2022, there were 111,008 deaths that occurred by 31st of July and were registered by 30th of September, which is 16,375 or 17.3% more than the historical average, end quote. 16,375 just in the first 7 months of this year, extra deaths, almost all, or predominantly not related to COVID. And yet very little reporting about this, right?
And not just Australia. This excess deaths mystery is in like lots of countries.
That's the other thing. That's the other thing that's true. In the US has had over 16,000 excess deaths just in people aged under 24 years since the middle of last year. The UK is running at about 15% higher than normal, as are many countries in Europe. So this is this huge 2022 rise in people just dying from everything. Cancer, dementia, diabetes related were the most elevated, but it's just across the board. And with my economics hat on, I think it should be even more puzzling because when we were worried about COVID deaths, the average age of a COVID death was 3 years more than the average age of a death from any other cause, right? So it's true to say that the average person who died from COVID lived longer than the average person who didn't.
Yep.
It's true to say that. Now, yes, it's a bit of a statistical trick the way I say it, but it's true. And yet, these excess deaths across all age groups are being ignored. And of course, if we are thinking in cost of life terms, if you die when you're 85, you're only expected to live a few more years, right? On average. And in many cases, very little time at all. But if you are under age 30, which is where we're seeing a lot of excess deaths, in the US, 16,000 under the age of 24, okay, you're expected to live another 70 years, 60 or 70 years, these people. So every death is like 25 to 35 times more life lost from a human when they die prematurely than when an 80-something-year-old dies prematurely from COVID rather than the next thing that would kill them. So these numbers are much more staggering in pure, raw human and economic and life well-being terms, however you want to measure it, than anything that COVID had. And yet this essentially complete silence this year, and no one seems to care. We're still panicking about COVID at Christmas time and not about this thing, this whatever it is, rise in deaths across all causes.
One theory is it's the vaccines. Another theory is people have basically neglected every other problem in their health. They haven't done checkups. They've been prevented from getting checkups. For like, it's been too hard to go and get checked up on various things, or they've been afraid to. But often it's been a matter of policy, like, oh, we don't want you to come in. We don't want you, blah blah blah, and things have been missed.
That's right. And I mean, people themselves are obviously not worried about other things when they're focused on COVID. So they're like, oh, I've got this weird stomach thing. Well, COVID's, it just doesn't seem like something you should worry about and get checked out. But I think you're right. I think it's a combination of lots of stuff. One is pure catching up. For example, if you close a hospital in a town for a few months, fewer people will die in those months because hospital treatments are risky. We take those risks in the hoping of extending life in the future. So shutting and delaying treatments that have risks will temporarily reduce the number of people dying, but those people then die from the thing that they were trying to prevent from taking that risk. So there's a little bit of catch up. If you look in the UK, you can see that. So there's some data that's come out from the NHS about the waiting period for heart disease tests and treatments. And there, prior to the COVID, there were 1,000 people who'd been waiting over a year for some kind of heart treatment. Now there are over 6,000 people who've been waiting for more than a year in the UK for a heart treatment. So that's 6 times as many people sitting around with heart issues, waiting for some kind of treatment that could make them live longer. And of course, that's all the result of the disruption to the health system from people being locked down, from hospitals being closed, from disruption to staffing, from vaccines and other things, travel restrictions, closed borders and the lack of supplies. So it's amazing that this was all known in advance. This was in the pandemic plans.
Yeah.
Now we're seeing the fallout. It's got a massive, massive human cost in terms of people dying prematurely. No one seems to want to be talking about it. And when you do, you get shut down. But if you panic about COVID during Christmas in the middle of an Australian summer, that's a sensible thing to write a news article about and get people worried about. So it really, it's doing my head in. I don't know about you, Jono.
There's a related thing that was doing my head in while I was in Thailand, and that was mask wearing, which is, so the government in Thailand told everyone that it was no longer required, it was now voluntary, right? No one stopped wearing it. And I'm talking about a country where there is compliance of 99.99%, both indoors and outdoors, and for children, right? And I have seen just some of my fury is rational and some of it's less rational, but let's just say I've been disturbed by seeing little kids, 3 years old, 4 years old, 5 years old, with these masks on. And I was in a fairly rural area, so there's a lot of space. People are not close together. And I had great photos. That I could have taken, but it would have been too embarrassing and confusing to ask people to take the photo. Like, I was in a library with no one, because the university library was empty because it was holiday period. And there was this one guy by himself in this vast space in one of the sofas, reading a book, wearing a mask. The most common sight outdoors was people riding motorbikes on dangerous highways with no helmets, in shorts and sandals, and with a mask.
No.
That's not like, oh, sometimes I see it. No, I see that like 1,000 times a day. Like
Oh my
everyone is doing that.
goodness.
Um,
Oh my goodness.
and I think the ties, it's no longer a medical thing. Like they know that it's like not about that anymore. It's just a fear of being told by someone in authority. And, this is obviously a cultural thing, a fear of being told by someone in authority that they're a wrongdoer, a fear of being called out, a fear of like standing out, of being different, of being disapproved of being told that they're selfish. That's something they're avoiding. And, occasionally in Thai social media, I've been told various figures in culture and society have sort of said, hey, when are we going to stop wearing the masks like the rest of, well, like the Western countries? And there's no real answer because
No.
employers haven't lifted the requirement, even though the government said, it's voluntary now. And well, like what bothers me? Okay, what bothers me is in a few years from now, it's like absolutely, as far as I'm concerned, 100% certain, but let's see, that in a few years from now, there'll be child development psychology, whatever papers coming out saying we've
Oh, 100%.
developmentally destroyed a generation of kids because we have masked them. This is obviously in countries where this is happening, because
Yeah.
we've masked them at crucial ages where, like, essentially now they've conditioned their young people to cover their faces everywhere except the home. And you can't convince me there's no effect on it. Well, I've had disagreements and arguments with foreigners who
Wow.
live in Thailand who have said, no, there's no difference, there's no harm, there's no problem. I
There's no
don't,
harm. Why weren't you doing it before?
yeah.
It's just free.
um,
Free benefits.
and I think some of the
Um,
thing that irritates me is the conformism thing, like the
yeah.
conformism thing resulted in my ancestors being
Yeah.
killed en
Oh,
masse in Europe, right? So I don't
yeah.
like excessively irrational conformism. And that it sort of really gets under my skin, like especially when I see Westerners who behave differently in their home country being very fastidious about mask wearing in completely stupid situations just because
Oh,
everyone else around them's doing it.
look, it's funny because I have a Japanese friend who told me that the same situation is happening there, that the masks were over in terms of policy, but no one would stop wearing them. And the prime minister has to keep coming out without a mask and telling people it's fine, but no one wants to stop. It's just this social conformity thing is so high. And just to wrap up, there was one more thing that comes to mind about closing schools and the costs of lost education and socialization. And if you remember, it was a big thing closing schools, and especially in the United States. And everyone said it would be fine, Zoom would be fine. And now all the research is coming out that it is not fine, that it's very hard for students to catch up and learn, and that we've essentially wasted years of people's lives not educating them. There's essentially zero learning gain in those COVID lockdown periods in children. So that's another real cost that we're going to see. And yet the crowd, the elite, were very confident with their stories that it would be worth it, that we'd lock down schools and no one would get COVID and there'd be no education losses. And yet here we are, 2 years later, seeing all the predictable outcomes from excess deaths to hospital waiting times for other things, from education losses, and that the vaccines weren't as good as we thought. And yet, as you said, the conformity, the respect for the elites, no matter what, still continues.
So I guess we could subtitle this episode, "And no one seems to care," with a dot, dot, dot.
Yeah. So let me leave you with this, Jono. If we had acted differently and followed our pandemic plans when COVID happened, we didn't close schools, we didn't lock down, we treated this as a bad flu season, how would 2022 be different? Would we have inflation? Would we have this backlog of healthcare? We wouldn't have had the education losses. So that's what I'm going to write about more in the coming months when journalists don't seem to want to do it.
Well, thanks very much for this week. Great discussion, and look forward to talking again next week.
For sure. Good to talk, Jonathan.